A lot of what people are seeing their doctors for is it sounds like it's a prescription for sore throat, but it's actually, did you hear what I said? And are you with me in my suffering?
Today, I sit down with Dr. Khan, a hospitalist turned longevity expert who's really flipped the script on modern medicine.
When your health breaks down, it's the most humbling time where we get to really trust and lean on people that want the best outcome for us. When you're in your last decades of life, what do you want to be doing? What do you consider valuable in your life? 90% of longevity comes from 5 basic tools. The 5 buckets of longevity medicine are.
All right, so Dr. Khan, I want to start off with longevity. Can you define it for me?
Longevity is one of those funny words because it can be applied to almost every discipline. But when it comes to medicine, longevity to me is defined as the length that you live your life, but the length that you live a good, healthy life.
So I'm happy that you actually touched on this, is because something that I love to talk about is the difference between lifespan and health span. Because oftentimes people say, oh, I just want to live a longer life. But you and I, as healthcare providers, we know that shouldn't always be the goal. So can you break down the difference between lifespan versus health span?
Yeah, that's a great question because lifespan and health span are totally different. So, lifespan can be referred to the quantity or the number of years that you live here on Earth. And then health span is how healthy you are during that time frame. And actually, Dr. Peter Attia came up with this longevity curve that's fascinating. It's a curve that's built off the x axis, which is the time, the lifespan, and then the health span is the y axis. And what you'll see is that people live to a certain maybe like 6th or 7th or 8th decade of life, and then all of a sudden they live their last few years of life like in nursing homes or in hospitals in and out with their chronic conditions that have now suddenly manifested, or their cancers that were undiagnosed with stage 3 and stage 4 cancer. So they live a really tough last 1 to 2 decades of life. And what the idea is to change the curve from being so sharp and drastic to the last few years of life being so difficult to like lengthen and create more area under the curve and extend out such that the last few decades of life are lived healthily. That does require a proactive mindset, which is longevity medicine, which is medicine 3.0.
Oh, I love that. And I am really happy to see this push because I'm trained as a physical therapist and I've worked in some of those nursing homes where you see these patients at the end of their life and there really is no quality to it. And so I'm sitting there seeing that medicine can extend life, but at what point is it worth it? And so I like that you talked about we need to start looking at a preventative approach. And that's where I want to dive in, is that you are someone that has really turned internal medicine and now focusing a lot on longevity medicine. But what made you make that shift and that focus?
Oh, I love this question. So I spent the majority of my career as a hospitalist physician, which means a lot of people don't know what that is, but a hospitalist physician is a doctor that works primarily in the hospital setting. So when you're acutely sick and the emergency room visit requires you to stay overnight, you get admitted to the hospital. An admission is required, meaning you stay overnight, you need orders, someone needs to take care of you the whole time you're there. So 24/7 hospital doctor monitoring. I saw a lot of acute illnesses, and some of them we reversed, but the majority of the patients that were sick for a long time and had really difficult conversations were the elderly. And I thought, right when the COVID pandemic hit, I was working in the hospitals and I thought, I can't do this forever. And realized that I needed to venture out and find something different because I wanted to get people's attention towards their health before it's not that it's too late, but before that it gets to that sticky part where you're in the quicksand or your parents are in the quicksand or your grandparents or whoever, and you want to optimize your health earlier, say starting your 40s or 50s.
So when you say optimize your health, do you think that there's any misinterpretations of what it means to truly optimize our health and well-being?
Oh, absolutely. So I am one of those people that calls out extremes. I think that there is a level of health anxiety being created in today's era, which is I hear commonly from my 30-year-old and 40-year-old patients, which is am I missing anything? I just want to make sure I'm not missing anything. And that's after a battery of testing and proactive measures, and people are exercising and sleeping well. But there is a level of health anxiety being created. And I watched a recent interview between Dr. Mike and the Prenuvo founder, who Prenuvo is a company that offers full body MRI scans. And of course, it's out of pocket, but the idea is to define cancer earlier because, yes, stage one treatment and prognosis is very different than stage three and stage four. But the Prenuvo founder said that he was treating health anxiety. And Dr. Mike mentioned a really interesting point, which is that, yeah, fear of the unknown is scary. And so when you ask me about optimization, it's a nuanced question, but it is very personalized. And I believe I'm one of the physicians that can help balance the two.
I love that. I actually, this is a big passion topic of mine because one of the biggest things that I see when I'm talking to people is that, like you said, they get all of these tests done and it actually evokes more anxiety than the value it provides in many times. And so you tell me, knowing that and being a doctor that's aware, how, if I want to be one of your patients and say, I want to go into longevity medicine, what does it look like for you? What test do I go through? What's the process that you do?
So what happens is when we work together, we interview each other. We see if we're a good fit because I also, while I call out the extremes, I also believe in the trust required between a doctor and a patient. So trust is absolutely required on both ends. That's a little soft thing to say. I understand that, but it's crucial to any relationship with your health. Health is probably the most surrendering experience when your health breaks down. It's the most kind of humbling time where we get to really trust and lean on people that we know more information and want the best outcome for us. So trust is key in working with me, and it's a bidirectional feeling. After that, it's all about learning the goals. There is a checklist of questions that we ask people when they want to work with us and build their longevity, which is their top three health goals. And in terms of short term, medium term, and long term. And that those are time sensitive. I believe in SMART goals. After that questionnaire is filled out and we discuss what their goals are, the long-term goals include the centenary and decathlon questions, which are when you're in your sixth, seventh, and eighth or last decades of life, what do you want to be doing? What do you provide? What do you consider valuable in your life? Do you love rock climbing, skiing, snowboarding? Is playing a guitar important to you? Is traveling and being able to lift your suitcase up over your head, is that important to you? Is playing with grandchildren or being able to cook and open jars and use your hand? So the first part of working with me requires an extensive interview and questionnaire process. And then after that, we'll get into the data and we do blood tests and recommend different medications or supplements based off of people's own genetic modifications and what they desire as their outcome. Lastly, after blood tests, there are imaging tests, which include things like a DEXA scan. So the fat that we're looking at is the visceral adipose tissue, which is the fat that creeps around the internal organs. I love the body composition scan, and I think that's like a crucial step in imaging. And based off of your goals, there are other imaging tests we can order.
Okay, I got you. So you're saying step one is an extensive interview so that you can understand what my goals are, what I want my life to look like in the future. Step
Yeah,
two is ordering tests so that we can get some baseline data. You can see where my lab values are. And then step three is looking at advanced imaging like a DEXA scan to look at my body fat percentage, seeing my bone density, things like that. Um,
exactly, exactly.
so tell me, I want to go to step two. I want to narrow into that one there. What are the main lab tests that you would order that help you determine how healthy someone actually is?
Well, going through the basics, I want to educate and empower people to understand and learn what the basic blood tests that most primary care physicians are doing, which is something called a complete blood count and a comprehensive metabolic panel. Now, those give us the basic insights into how well your bone marrow is functioning, how your kidneys are functioning, how your liver is functioning, what the electrolyte statuses are, and it gives us an assessment of your nutrition status. There's a number or a protein called albumin that we look at that gives us an idea of how well you are nourished and how your nutrition is. Those are the basic bread and butter tests that your doctor's already ordering. The other tests that we're more interested in learning about are for risk prevention, which are your cardiovascular markers. I love testing inflammatory markers like high sensitivity CRP and homocysteine levels. Also, a lipoprotein little a test that's been heavily popularized recently. It's a once in a lifetime test that determines a person's genetic risk for cardiovascular disease. Next is the ApoB levels. This is a more precise measurement of heart disease rather than traditional LDL levels. The third test is called the NMR lipoprofile test. Your traditional lipid panel is going to give you LDL-C particles, which is calculated LDL. LDLP, which is you're going to get from the NMR lipoprofile analysis. Basically, these things are proteins that carry cholesterol to and from your heart, and they're labeled good and bad cholesterol based on if they're taking it to the heart or away from the heart. Another test that we could do is an ApoE, which gives you a genetic risk for your possibility to develop Alzheimer's disease. So these things are really sensitive, Spencer, and you really want to make sure people want to know this information before we go ahead and order a panel of tests for people that may or may not be open, willing, or able. I use that three-pronged method for almost everything in my life: awareness, action, and results.
I'm happy that you finished with that because that was something I wanted to dive into. I was like, you're listing to me 30 to 50 possible tests that as a consumer could be anxiety producing. So I can see where phase one is super important to this person so that you can say, instead of ordering all of the tests, I'm going to figure out what are the specific ones that may be applicable to you. But tell me this, you said I could get all these tests at a primary care doctor. Why wouldn't I just go see my PCP?
Your PCP can order these tests. You'll have to possibly advocate for yourself to ask for these tests. I think more and more doctors are becoming aware to being proactive. It's just that it's there some of these tests are not covered by insurance. It takes a long time, Spencer, for things to get approved and go through the chain of FDA approval. I actually don't know what the chains of approvals are for insurance to cover some of the newer tests, but I do know that medicine, like law and education and politics, is a little slow to change. And that's one of the reasons that it might be of your best interest to find maybe a longevity doctor or a doctor that has similar values as you.
That's fair. And I don't think you're getting the guidance that you would get if you were to go to see you directly.
Yeah.
Now, people, as long as we've lived, have always wanted to live as long as possible. But this shift towards longevity medicine is a fairly newer or at least trending topic. So tell me, because I know some people will argue that the longevity space, a lot of it's actually built on unproven science that comes from animal data. And so, how do you respond to something like that?
Well, it's a valid point. It's a valid question. And that's one of the reasons I don't call myself a functional practitioner, a holistic doctor. Through and through, I am a board certified internal medicine physician. And that's all I can claim that I am. That's what I've been trained in. That's what I've been practicing in. And so, what happens is that the way studies work generally is that they're tested on animals first and then humans later. While a lot of people say it doesn't work, it actually does. Medicines do work, and drugs go through an extensive amount of scrutiny before they're released to the public, and FDA regulations. A lot of people like to diss the FDA and say whatever they have to say, but the truth is that they do work and people do need them.
I want to touch on the point that you were talking about is oftentimes with research, it does start with animal based studies. And so oftentimes we can pull really valuable insights that we can apply to humans safely before it's actually tested on a human. Obviously, you as a doctor are going to do a risk stratification to determine if I feel that this is too risky, that the evidence isn't strong enough, then you're not going to apply it. You're not going to prescribe that recommendation or that supplement yet. So I think that's important for someone who says, no, it's only based off animal studies. You have to understand that this is a nuanced thing here and that they're looking at the whole picture in order to make the best decision for you. Would you say that's accurate?
Oh, absolutely. I think that's totally accurate. Every single intervention we take in life, whether we're walking across the street or driving to work, has a risk and a reward. Same thing goes for your healthcare. Same thing goes for testing that you do. Same thing goes for testing that you don't do. And as physicians, we're trained to focus on the risks. And that means preventing harm. We use the evidence that we've gained in order to create guidelines like the United States, the USPTF Preventive Task Force. They have guidelines for what age we want to recommend screening for breast cancer, colon cancer. And actually, Spencer, this is pretty groundbreaking, but colonoscopy screening used to start at age 50. And it is incredibly groundbreaking that it shifted from age 50 to 45. So it does mean there is consciousness and awareness in at those boards and at those levels that we're missing cancer sooner in younger people. I mean, I'm curious when you talk to people about screening tests and what screening cancers do you think of first? I'm just so curious because we look like we're the same age, so I feel like I'd get some great feedback from you.
Sure. I mean, I think of prostate cancer, but then, yeah, also colon cancer. But you tell me, what would be the main ones that we should look out for?
In all of my physical exams or wellness visits or whatever we call them, the top 3 that I think about for everyone are actually lung cancer, colon cancer, and breast or prostate cancer. Testicular cancer is another common one that I would want to know about sooner and quicker. Like the treatment's totally different for stage 1 versus stage 3 to 4. Cervical cancer for young women, that's a big one. Unfortunately, I lost a friend who in high school, I guess she never got a pap smear or whatever the case may be, but I found out about 5 years ago that she passed away in her 30s from undiagnosed cervical cancer, and that was a preventable death, and it's that serious. So cancer screenings are incredibly important, and that's one of the ones I'll say, don't wait till it's too late. Follow the guidelines and at the bare minimum.
We have to acknowledge that something's going to kill us one day. It's
Yeah.
inevitable. If
Right.
we look at the data, the biggest killer is heart disease, which is why you're running a full lipid panel looking at their heart and cardiovascular health. Then we look at things like cancer, mental health, diabetes, metabolic dysfunction, right? It's going to be one of those combinations that's going to take us. However, what I'm taking from this is that if we can listen in a little bit early so that I can be more in tune with my body, but then also use the modern resources that are available to me, then I'm actually going to help maintain those systems to keep the homeostasis. And that's not only going to help me live longer, but it's going to help me live better. Would you say that's true?
Absolutely. I've taken care of the privileged, educated, super wealthy people of Santa Monica and the Pacific Palisades and the west side of Los Angeles. And I've also taken care of a community in Compton and Watts and underprivileged. And I will tell you, Spencer, that I have taken away some tremendous insights from taking care of these different populations. And not to say one's right or wrong or one's good or bad, but they're just my personal insights and opinions, which is that the West Side crew, the worried well is what I'll call them. There are a sense of worried well population on that side, which is basically, am I missing anything? Do I need to know anything more? Are you sure I'm okay? Because like I don't feel okay. And there is a sense of, I want to say, mental health awareness that I do, the anxiety piece that I think we get to bring a little more awareness on. And then in this population where there's less resources and maybe less education and maybe less like attention and awareness towards what I need to be doing, and the type of foods in those grocery stores and those markets are completely different. I can't get basic groceries that I eat in those neighborhoods like when I'm taking a break from work because they just don't sell them there. And their diseases are tremendously more physical. I'd say that they're physically sicker. And so there there is a sense of ease and peace in highlighting the tools that are needed to take care of your emotional and mental health. And that's the point that I wanted to nail home with comparing the two populations, which is that you've got to know that you're taking the best care of yourself you can in every way, not just physically running every day, lifting weights and hitting the sleep timer and all that, but you've got to know that things like tools like therapy, meditation, journaling, walking, talking to someone, the me time, whatever it is, that is tremendously important for your well-being.
That's actually a really interesting take on it, saying that the wealthier may have all the resources to fuel their body correctly, to make sure that they have the right clothes, the right health, but they're oftentimes suffering from a lot of mental health dysfunction. Whereas the poor populations can't afford those healthier foods. So they're eating things that aren't fueling their body, and that can lead to physical manifestations. And so this is actually one of the biggest criticisms that actually comes with longevity medicine is that oftentimes people say that this is only for the rich and the wealthy because it's not something that's
Yeah.
typically covered by insurance. So in this current day and age, could someone that's a lower socioeconomic level access your care? And if not, what steps do we need to take so that they could have access to something amazing like this?
I love this question because it breaks up one of the biggest medical myths that you need money to be focused on longevity, that you need money to buy gadgets and you need money to invest in all these tests. 90% of longevity comes from free 5 basic tools. And I will build the mental framework for this visualization exercise, but the 5 buckets of free longevity medicine are sleep, exercise, nutrition, social connection, and mental health or mental well-being. I'm going to break it up into the framework of building a house. So, sleep is a non negotiable. Sleep is the foundation of your house of well being. Without sleep, without the foundation of the home, nothing else can be built. The next pillar is exercise. Exercise can be represented by the nuts and bolts and hinges that are required to build your house of well being. After exercise, you're going to build the walls of your home, which are built by nutrition, the third pillar of longevity. Nutrition is the food you eat, and it's what your body will be made of. Eat less and don't eat too little. I think for nutrition, it's hard to nail home a specific science based thing. It's just too nuanced. But generally, as an American population, we eat too much and we eat too much salt, sugar, alcohol, and fried foods, fast food, all of it. The fourth pillar is represented by the doors and the windows of your home, which is social connection. There's a Harvard business study that says that the quality of your life is based on the quality of your relationships. And I truly believe that, especially when you're on your deathbed in the last few days of life. You don't care about how much money you made or how hard you worked. You care about the people that are there with you or for you, or the lives that you've touched along your journey. So, the last pillar or the last part of your house of well being is the roof, which is your mental well being and stress management, how you take care of yourself. It shields you from the external world and how well you're building your roof of your house of well being, which is the fifth and final pillar, which is mental health. I've created this little framework and system. I like frameworks and systems. The mnemonic that I use is SENSM: sleep, exercise, nutrition, stress management, or sorry, social connection, and mental health. And so hopefully that is one of my take home points, that 90% of longevity and living a long, healthy life is free.
That is such a good framework. And
Thank you.
oftentimes people are being like, what's the medicine that I need to be taking to get me healthy? What surgery do I need? What kind of injections do I need so I can recover and be healthy again? But you're saying instead, yes, those things have their time and place. However, if we focus on this framework that you're talking about, they're going to be able to cover a majority of actually what's going to help us live longer and better. Now, my question is, why are these principles not applied into modern day medicine already?
That's a great question. It's not that they're not applied into modern medicine. It's that as human beings, we are nuanced creatures. I think that the way our self discipline and structure is built throughout life is different. So, a lot of these pillars are maybe things we can teach kids in school. I think it's an education piece rather than a modern medicine piece. Or it's probably a little both. I mean, I don't know the true answer to your question. It's a great question. Like I said, modern medicine and doctors will always focus on the risk to make sure we're doing no harm. I think that's the Hippocratic oath. It's do no harm, because there is technically a lot of harm that we can do. The way I even speak to someone, I know I have an authoritative, direct, I wear a white coat, I have a stethoscope. So what I say, people hear and they listen. So what I say matters. And I have to make sure that I'm doing no harm. And I think focusing on what's going to kill you gets a little more of the attention, unfortunately.
It sure does. And that's why we're on here having conversations like this to raise awareness of being like, let's fight that misinformation and talk about what's actually important, what's actually probably a little bit more evidence based. But with this, of what you're talking about right now in this framework, how much of it did you actually learn in medical school?
That's a tough one to answer. 0, 0%. Look, Medical school required a ton of learning, and it was all a foreign language. I got through medical school with creating frameworks and drawing algorithms over and over. So, why it's not taught in medical school? Let's just say the reason we are doctors is because we had to go through extensive education and training. If the focus may have been on the 5 pillars that I just mentioned, sleep, exercise, nutrition, social connection, mental health, awareness, and stress management, we still need to know how to treat pneumonia and bronchitis and COVID and cancer.
No, I asked this for an important reason because the reason that I believe it's not incorporated into modern day medicine is because it's not taught in modern day medicine. So why would it be in it? We all know and acknowledge that this is something that we need to make into our lives more frequently. And it's going to start with systemic changes from policy to the way that we're educating our doctors. And we can even look cross culturally at countries like Denmark and Finland, Norway, ones that have really high quality of life, good healthcare systems, and oftentimes they prioritize the exact things that you're talking about right now. And so it would be cool if we could train our doctors to learn these foundations, how we can implement it into practice, how you have had to learn really through experience and continuing education. And then I believe that we'll have kind of a brighter future. What are your thoughts on something like that?
I agree with you in theory and in practicality, yes. I also disagree with you in that teaching the medical students about the free 5 basic pillars is something that should be started, like, in kindergarten. It's not something that should just be given to the doctors. It should be implemented as in a societal, like you're saying, culturally, and change the game in terms of our societal awareness and our consciousness. I'm writing a book called No One Ever Told Me, and
Oh,
one of the topics is on being a doctor. So I'm gathering information and data from people on, like, on being a firefighter, on being a parent, on being things that are, like, really juicy, that it's like healthy ranting, I'll say. But no one ever told me on being a doctor that the amount of experience that I would gain would be way more than anything I learned in medical school. Because a lot of what people are seeing their doctors for is, it sounds like it's a prescription for Z-Pak when you have a sore throat, but it's actually, "Did you hear what I said, and are you with me in my suffering?" And so there's a huge psychological impact that doctors can create in terms of patient care, and that's something that I only became aware of with a tremendous amount of experience. And so I'll say that yes, it should be taught in medical school. Yes, it should be taught to everyone at a young age. And also, we've got to own the awareness when it does strike. Like when it did hit me, I changed. And it was really difficult to leave hospitalist medicine, something I knew really well, something that I'd been doing for years. But I
yeah.
did, and here I am.
I love that. That is a big reason of why I started this podcast is really to help the public gain ownership of their health, but then also to bring amazing doctors on like you who have lived these stories where you've seen patients go through these things and oftentimes you can't talk about it in a healthy way. And so you sharing these experiences with us is so valuable. And I love it. I didn't know you were writing a book. Do you have any idea when that's planning on coming out?
Oh, it's been written for at least 5 years. Let's just say 2026 to put it out there, but you reminded me of a story I have to share. So in residency in New York, the first inkling that I got about, am I doing no harm, or am I taking, did I sign up to do this correctly, was when I was asked to put a nasogastric tube down, like a feeding tube down a patient that was nonverbal and couldn't move, not walking, not talking, not there. I was asked to put an NG tube down to help her eat or get nutrition because that's what the family wanted. And I was in my second year of residency in New York at a community hospital, and it was tough. I remember feeling like this is not normal. The tube wouldn't go down because it requires the patient to also swallow while the tube goes down to make sure it doesn't go in the windpipe instead of the esophagus. And it really did feel like I was torturing someone. And I have been holding on to that story for a while. And so, yeah, there is not many healthy. I appreciate you starting the podcast and asking me to be on it because it's a lot.
Yeah, for sure. Is there any takeaways that you feel like you got from that story and how you maybe treated a patient differently from that experience?
I will say that I have longer conversations with family members now. But because of our system and the way things work in the hospital, we can't do more than 20, 30 minutes at a time. And people really need time to grasp things, not just doctors, but patients too, and patients' families, I think. Have you ever watched the show Pit on HBO Max?
No, I've heard it's a good show though.
It's incredible the way that the writers and that crew and everyone on that show has shown difficult interactions on episode. Each episode's like an hour of the ER shift. And so there is a patient who's from the nursing home whose son and daughter have a really difficult time honoring the patient's own DNI wishes. And I guess I'll use this opportunity to share there's a lot between doing everything and doing nothing. There are about 5 basic things. So doing everything means full resuscitation, life support. God forbid you and I dropped dead right now. Everyone would do everything to get us to return us to health. Doing nothing means allowing a natural death, no resuscitation, no CPR, no ventilator, no chest, those things break ribs, and just allowing a natural, peaceful death. Things in between those are intravenous medications, blood transfusions, feeding tubes, hemodialysis, because once we start getting sicker, we have more decisions to make. And so one of my passionate topics is to educate and get people like on board with what they want and what they don't want sooner and to talk to their families about it because we are all focusing on living longer and also we want to live the best quality of life. So I think the takeaway from that story was spend more time with patients' families and do my best to communicate and educate people on what their quality of life means to them.
That is super powerful. I can say, as a clinician that's worked in the ICU, I have seen those conversations where families have held on too long and they've pushed for care where it's really not benefiting the patient anyway, but they're unable to create that separation. And there probably was some time where they felt like they weren't able to have that true conversation with their doctor to
Yeah.
understand what is the risk versus the benefit of what's actually going on here. And so I so appreciate you making this realization and coming to terms of being like, we need to really sit down with these people and help them truly understand number one, the wishes and desires, and then what would actually be the best course of action. So I have so much respect for that.
Yeah, thank
You,
you.
you,
So it's like it starts with us, right? Like how I am with myself and my life, and then with my parents and with my siblings and my aunts and uncles, right? So I do believe in that. Like the only change you can make is the one within yourself. Even though I am a physician and what I do say matters to people, one of my mentors actually acknowledged me and said, "You remind me of someone like physician healed thyself." I thought that is really powerful because I've done a lot of work to creating this kind of awareness.
you're amazing. That is awesome. Dr.
Thank
Khan, I
you.
so appreciate you willing to come on here. Tell me if someone wants to learn more about you or even work with you, where could they go?
I have a website, mywellnessmd.com, because I am your wellness MD. And you can find me on Instagram or YouTube at the same handle, My Wellness MD. You can Google me, you'll find me as one way or another.
Awesome. And we are going to set that deadline 2026. Your book is going to be launched. It's going to get done. Let's get this
Yes.
thing done.
Yeah. Thank you so much for that support. I need it. A healthy collection of rants, and I'll take yours on building a podcast and your physical therapy insights.
Amazing. Thank you so much.
Thank you.